The key idea about diabetes management is not just giving you advice related to how the sugars are, but also patient empowerment. Now, that is an extremely important principle so that you understand exactly what's happening. Now, these are the last 3 days of your diabetes, as we know, and we can clearly see a difference in the days between 5th and 6th when you had some hypos overnight. Before that, that was not happening. And this is the beauty of these monitoring devices, because they can give us a lot of information and we make the best use of them. And the best thing about you is that you have been adding a lot of notes. So this is exactly what we need to make sensible judgments. Now, previously you had been on very high dosages of insulin. The long acting is 70 units Tresiba and then 15 units of Novo Rapid with correction as well for the steroids. And you have plenty of notes there to help us make sensible judgments. And still we were seeing the overnight glucose readings being high, as you can see. And that's where we started to make some change when I commenced you on Manjaro, which is tirzepatide, and your appetite dropped, which led to the drop in sugar readings, and we dramatically reduced your long-acting insulin and skipped all the rapid-acting insulin. Now, usually, these long acting insulins can last in your system about 48 hours, and sometimes they claim that Tresiba can still be there for 72 hours. So we had to wait. Now, you can clearly see the difference between the nights of Friday, the 6th of September, and Saturday, the 7th. So, again, as we drop down the dose dramatically, we are seeing high readings overnight. This is not entirely because of what you ate at night. I think the food was fine. You have taken 4 units of Novo Rapid, as I can see, which perhaps made a good difference preventing a big spike. But I believe you need to go up on your Tresiba based on this information. I'll drop down a text to you about your dosages. My role is always to make sure that I empower my patients so that they have the understanding behind those adjustments, and they know how to make things easy for them, even if they are not directly connected to the clinician, and they can make these sensible adjustments themselves whenever it's necessary.